Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Aiman binti Muhammad Yusuf and my matric number is 1220374. Today I would like to present about evolution of media effect theories. In this assignment, we cover about three topics. Number one is hypodermic needle theory. Number two is two-step flow theories, and number three is selective exposure theory. Introduction is the hypodermic needle model suggests media directly injects message into passive audience. The two-step flow model proposes opinion leader mediate information between media and the public. Selective exposure theory posits individuals choose media that align with their existing into how messages are perceived and disseminated in society. Media effect theories overview. The hypodermic needle theory is magic bullet theory that media has direct and immediate effect on its audience, shaping their opinion and behaviors. The two-step flow theory, medium effect, proposes that media messages are not directly received by individuals but instead pass through opinion leaders who in turn influence others. Selective exposure theory posits that individuals' activity choose which media messages to expose themselves to based on their existing belief, attitudes, and preference. Topic number one is hypodermic needle theory. History emerged in the early 20th century, influenced by the rise of mass media and propaganda during World War I and II. Main concept: media directly inject messages into passive audience, assumes immediate and powerful impact on attitudes and behavior, implies many audience interpretation or resistance, reflect a one-way communication model where media has authoritative influence. Topic number two is two-step flow theory. The history is developed in the Paul Lazarsfeld and Elihu Kurtz in response to the limitation of hypodermic needle model. And the main concept is opinion leaders mediate information between media and public. Information flow from media opinion leader the wider public, emphasize the importance of interpersonal communication, challenges the notion of a direct immediate impact of media on individuals. Our last topic is selective exposure theory. The history is evolved in the mid-20th century with the growth of media choices and increased individual agency in media consumption. Our main concept is individuals' activity choose media aligning with existing belief, preference for contents confirming one's worldview, emphasize individual agency in media consumption, lead to the formation of filter bubbles and echo chambers. The conclusion. In conclusion, the hypodermic needle theory, two-step flow theory, and selective exposure theory are all communication theory that have been influential in the field of media studies. The hypodermic needle theory assumes that media messages have a direct and powerful influence on the audience, while the two-step flow theory emphasizes the role of opinion leader in the transmission of information. The selective exposure theory suggests that individuals trying to choose media content that is consistent with their belief. While these theories share some similarities, they differ in their assumption about audience activity, the communication process, the role of opinion leader, and the timing of information flow mass media to the audience. The hypodermic needle theory has been criticized for its simplistic mobile model, while the two-step flow theory has been criticized for its limited scope and lack of empirical evidence. Despite this criticism, this theory have contributed to our understanding of the complex dynamic of information dissemination and opinion formation. Thank you. That's all for me.